Hello, our listener. Today we have reviewing and still continuing the Live Aid to Diabetes and Diabetes Management. It's well known now what's the meaning of diabetes, but till now a lot of patients are discovered with diabetes and can manage diabetes. So we are so pleased to announce about our guest for this episode, Dr. Revolution, General Practitioner from Dubai. Welcome, Dr. Revolution.
Thank you so much, Dr. Diana, for having me again on your platform. And I'm very happy that we have an opportunity to talk about one of the most common conditions encountered by most of the people around the world. I'm sure a lot of people are already familiar with diabetes, and I hope today's session will be productive and more informative to people who are having diabetes or who are in stages or whose family are having diabetes.
Yes, exactly. So, Dr. Revolution, before dive into management of diabetes, can you support us with some information and insight about spreading diabetes year by year?
So, generally diabetes, most of us might know of it as a sugar problem. So it is a chronic condition, meaning like, you do not wake up one day and you just have a diabetes. So usually it happens over a period of time. So it is a chronic metabolic condition that is characterized by hyperglycemia. When you say hyperglycemia, very much elevated level of blood sugar levels. That can be either because of insulin secretion problem, or it could be because of insulin resistance problem. So based on that, we can classify diabetes into type 1, type 2, a lot of other forms of diabetes that we'll not be talking about today. So most commonly known diabetes are type 1, that is insulin, there is no insulin production at all. Type 2, well, there is insulin, but the cells are very resistant to the insulin. And there is something other called gestational diabetes, meaning people who were never diabetic during their pregnancy, they can develop diabetes. So basically, the diabetes means chronic condition due to which there is problems in sugar regulation.
So, Dr. Revolution, there is a big concern about managing diabetes. So, can you tell us what the primary goals are in the managing diabetes in adult patients?
So, for the diabetes, our primary goal, since it is something to do with sugar regulation in your body, our primary goal is to maintain or to attain a target that will not cause problems in the different organs of your body. So the targets can be different for different populations. Like if you're young, if you're old, your target levels can vary, because for younger people, you can put on a stricter target, while older population, if you try to attain the target, they might go into hypoglycemia. So first thing is controlling the blood glucose and attaining a target that is according to the guidelines. The second thing is we also have to look into preventing the complication that comes with diabetes. So for example, there are like macro and microvascular complications that we say, the kidney diseases, the eye problems, the peripheral arterial diseases, the heart problems, the neuropathy, the tingling sensation people complain about. So that is the second thing. So these are the main primary goals of managing diabetes in an adult patient.
Great. Dr. Revolution, as you mentioned previously, diabetes is a metabolic condition. So life modification is a very crucial in this medical condition. So what are the key lifestyle modifications that you recommend to your patients with diabetes?
So when we talk about lifestyle, of course, all of us, we have always heard about healthy eating. So we have to understand what really healthy eating is. There are a lot of people who are saying, okay, I'm eating only one time a day, but just a few amount of high carb chocolates. So that is not healthy eating, So there are different forms of diet that has been around the world. Like, you have heard about keto diet, you have heard about intermittent fasting and a lot of other things, right? So first thing is healthy eating. So you'll have to understand what kind of diet is best for you. So of course, you do not want something sugary that spikes your blood level so high that it takes very long time to go down. So you want something, there are studies that has been conducted. It shows that low carb diets are very useful compared to intermittent fasting or keto diet. So the basic difference between low carb diet and a keto diet is that low carb diet means there is low carbohydrate. Keto diet is like having a carbohydrate in a level that it is very less than 50 grams per day. So there have been studies comparing these two. So they say that low carb diet is much beneficial compared to other form of diets. So that is one of the thing. Second thing is exercise. So exercise, being in a busy world, working 24 hours a day, maybe working 2 jobs or something like that, it's very difficult for people to find time for exercise, but exercise is one of the most important thing. So exercise doesn't mean that you have to spend hours and hours in the gym. It's just that basically, per day, if you allocate 30 minutes of your time, you can just do some, brisk walking or maybe light jogging. If you don't have 30 minutes, maybe 15 minutes per day, you can spend running a little faster compared to jogging. So exercise is second thing. The third thing is weight management. So of course, obesity is usually one of the causes of insulin resistance. So you also want to manage your weight. The third thing is hydration and stress management and sleep hygiene, because these things can also influence your blood sugar levels. Other lifestyle things wise, smoking, of course, drinking alcohol. So these things are the key lifestyle modifications that we have to focus on when dealing with diabetes.
Exactly. So, Dr. Evolution is a chronic condition, so most probably patients need medication all the time. So, how do you approach the use of medication in managing diabetes, and what's the factor influence your choice?
So, when we talk about managing patients with diabetes, a lot of things has to be taken into consideration. No? First thing is the age of the patient. So, age of the patient is also relevant in a sense that usually younger people tend to have type 1 diabetes compared to older population who tend to have type 2 diabetes. So, of course, if you have type 1 diabetes, the medication of choice usually tends to be insulin. But if you have type 2 diabetes, maybe you go start with something called metformin. The second thing is the use of medication also depends on your glycemic target levels. Meaning, for example, let's say you are taking medications and your sugar is still not under control. So now choosing the right medications will also depend on your target levels, what we want to achieve. The third thing is the incorporation of diet and exercise is very important along when you're starting the medications. Another thing that we have to take into consideration when managing the patients with diabetes is associated comorbidities. So for example, let's say if you have hypertension, which medications would be best for you? If you have chronic kidney disease, which medication would be best for you? So these things are there. Other things could be, compatibility with your life. Like for example, if you are a very busy person and you are told to take, you have to take these medications 5 times a day. So of course, there is chances that you'll not be following that, right? So following, thinking about patients' lifestyle is also very important. Their busyness. So, another thing that we take into consideration is the cost effectiveness of the medication. So for example, let's say that you're earning salary 1000 dirham per month and the doctor has prescribed you medication worth 500 dirhams per month. So are you gonna buy it? No, of course. You'll be spending that amount on the food, right? So those things are there. Besides that, we also have to take into account what are the side effect profiles of the medication. Like for example, somebody has, let's say somebody's overweight or a little bit obese. So in that case, if you keep medications that will increase their weight, so that's going to be a problematic thing. So we have to take into consideration what are the side effects that can be present with certain medications. And of course, the most important thing is there is no one shoe that fits all. So definitely we have to personalize the treatment according to the patient, because these are all the factors that we have to take into consideration when we are trying to manage a patient with diabetes.
Great. Dr. Evolution, insulin therapy sometimes causes horrible effect on patients. So when it's recommended?
So usually insulin therapy is recommended if you're a type 1 diabetic, meaning like type 1 diabetic. We also call it non-insulin dependent diabetes. So in this case, what happens is that your body is not able to produce insulin at all. So just imagine insulin is very important for sugar control. So if your sugar goes up, your body releases the insulin. So now this insulin, what it does is like it reduces your sugar level down. Now, since in type 1 diabetes you don't have insulin at all, so medication would not really be effective. It can help in some way, but insulin will be the first line of choice. But for people with type 2 diabetes, usually we start with medications first. Then later, let's say if we have started them on multiple medications, or if because of the medications they are having severe side effects, then we usually tend to go and step up to the insulin to have a better glycemic control. And of course, if you're pregnant, there are many medications contraindicated that you cannot use. So if you're pregnant and your HbA1c level, that's your average blood sugar for the past 3 months, is more than 7%, then we would usually start you on insulin. So these are the instances where we use insulin.
Great. So, Dr. Revolution, what is the role of continuous glucose monitoring in diabetes management?
So when we talk about continuous glucose monitoring, glucose monitoring, basically it's something that has come up very recently, and many of the people, especially patients, are really happy about this, because it saves you time of going to the clinic and pricking your finger every time and getting hurt every time. And most of us, we don't even go to the clinic to prick the finger because we are scared about the needles. So continuous glucose monitoring, basically it's a technology, it's a device where they place a monitoring device that is either in your upper abdomen or in your abdomen or your upper arm. So that what it does is that it can send continuous blood glucose levels either in your cell phones. So you can actually see the real-time blood glucose levels, what is your real-time blood glucose levels. So this has really helped a lot of patients, because the more frequently you look at the blood glucose levels, the more aware you are about it, and the more you'll be concerned about, okay, I should be doing this, I should be doing that. So this is it's a game changer. And also one of the important things with the continuous glucose monitoring is the continuous CGM, what we call CGM, is also incorporated with insulin pumps. So meaning what happens is that the hassle of taking the medication, remembering to take the medication, is lessened down. So what will happen? The glucose monitor will automatically detect your glucose levels. So based on that, there are pumps that are also inserted on the other side, so which can release the insulin depending on your sugar levels. And also for older population, it also prevents the side effect of having hypoglycemia.
Perfect. Dr. Revolution, some patients struggle to follow the plan of the medication and lifestyle. So how do you handle and manage these patients who struggle to adhere to the plan?
Okay. So first thing, for someone to adhere to a basic plan, the most important thing for them is to understand what is really happening. So for example, let's say if you do not understand what is happening, you're less likely to be interested in things that is happening to your body as well. So first thing is always listening to them with empathy and understanding, what they are struggling with. So why are they not adhering to the medications? So maybe there is some barriers that you can help out. Maybe it's the financial barriers that we talked about, right? Maybe it's the understanding. They just thought, okay, it's just diabetes, it's not going to cause me anything. Maybe that was the misunderstanding they had, So educating them on the complications that could be there if they do not take the medications versus the benefit of taking the medication. As well as, you also have to set a realistic goal to the patient. You do not tell to a patient that you can come to me, I'll get rid of your diabetes. No, you do not say that, because if you give them too much over expectation and you fail to meet that, the patient might end up being non-adherent. And also you have to, for most of my patients, what I do is that whenever they come to visit me, I encourage even every little things that are positive for their health. So meaning let's say the recommended exercise is 30 minutes per day, but somebody just comes and tells to me, doctor, I started walking for 10 minutes per day. I would say, okay, that's very good, that's very good. Let us try to like slowly pick it up. No, you do not say like, okay, go and run 30 minutes now. Somebody who has not run like almost 5 or 10 years of their life, if you tell them to run for like 30 minutes, they are going to be most likely, not going to be back for running for some time again. There are also other things that we can advise them, like having applications to do the calorie counting. This is very popular, so people really become conscious about what they are putting in their body. So yeah, I mean, if the patient are non-adherent, it is important to identify what is the cause that is causing this non-adherence and focus on those things, and encouraging every little improvements with positive feedback and reinforcement.
Great. So, Dr. Revolution, diabetes is not only metabolic condition, but also have a lot of complications. That's the fear of many physicians that makes them trying to all approaches to manage diabetes. So, what are some common complications of diabetes and how can they be prevented?
So the diabetes complications, there are a lot of complications that comes with diabetes. So the complications, one of the most important complications being death from myocardial infarctions, stroke. So as much as we don't want to scare the patient that you might be having this in the future, sometimes somebody is non-adherent to the medications. We really have to let them see the picture of where this is headed in the next 4 years, 5 years, or next 10 years. So other things are, a lot of people come to the clinic, they are complaining of numbness in the hands. So that is one of the complications, that is we call polyneuropathy. So other things are like, people complain of blurring of vision, diabetic retinopathy, kidney failure. Some people even complain of digestive issues, such as not being able to digest food properly. So these are like some of the complications. Some people, like, of course, I'm sure you're aware as well, or maybe some people had already seen cases where that somebody had to amputate their leg because of the diabetic complication of the diabetes. So that is, we call it peripheral arterial disease. If not taken care, you'll have to really amputate everything below your knee or the whole leg as well. So these are some of the. So when we talk about prevention wise, it's the basic same things that we have to focus: diet, exercise, maintaining our target levels, and managing comorbidities that comes with diabetes. So these are the basic things, as well as focusing on, for people who are at risk, focusing on preventive measures to help, education or like talks like this can really help people understand regarding the problems that diabetes can cause. So these are the things, that can help prevent this kind of complications.
So, Dr. Revolution, how do you manage patients with diabetes and its comorbid with different conditions like hyperlipidemia and hypertension?
So a while ago we talked about choosing a therapy for a person with diabetes. So one of the criteria for choosing the therapy was what is the associated comorbidity as well. So for example, let's say if a patient is hypertensive and he comes to me, he's also a diabetic. So there is some certain medications that I would prefer compared to another, because this, we call it ACE inhibitors or ARBs, with angiotensin receptor blockers. So these are more of like losartan, olbisartan, telmisartan, captopril, lisinopril, this kind of medications. This kind of medications in diabetic patient has shown to improve their overall mortality, and it also reduces their cardiovascular risk, as well as it has some beneficial effects on their insulin sensitivity. And regarding the insulin sensitivity, but this medication, like I said, sartans and ACE inhibitors are usually, it is also helping improve the insulin sensitivity in patients with diabetes. So in hypertension, it is like that. But when we talk about dyslipidemia or hyperlipidemia, usually we tend to, usually people, if they are diabetic and they're already 45 years of age, we usually already tend to put them on statins, because the studies have shown that starting statins, even though there is no elevated cholesterol in diabetic patient, has a very good benefit on reducing the all-cause mortality in the patients. So yeah, deciding factors really depends on what are the comorbidities associated with the diabetes as well.
Great. Dr. Evolution, you have already mentioned the patient education. So, what is the importance of patient education and what is the strategies that you follow to educate patients?
So one of the most common things as a clinician is that when the patient comes to you, you have to try to educate them in a way that they can understand. Not using too much of medical terminologies and using terms in such a way that anyone can generally understand it. So we have to ensure that what we are saying, it doesn't matter what we are saying. We have to make sure what we are saying is being understood by the people that is listening to it. So that is one of the things, breaking down communication barriers, one of the most important thing. And also, if you cannot understand something, if somebody, like for example, if we are talking to each other, and for example, let's say I have diagnosed someone with diabetes, then if I explain to them diabetes this and that, but if they are not able to understand what it is, they will not be able to comprehend the gravity of illness that they are facing. So it is very important that you convey the conversation in such a way that it is understandable by the people. The other ways can be, you can talk about, we can do podcast. We can share the podcast with our, viewers or patients, so they can understand more about the diabetes. There are other things like, visualize. Usually in my clinic, in the front we have a TV. So I usually tend to put like these three things on the TV always: the hypertension, the diabetes, and hyperlipidemia, because this is one of the most common condition. So usually when the people are waiting to see me, then they can watch the TV and they can get to know some idea about diabetes. The other things are like helping the patient understanding on how to take the medications, how to inject the insulin, how to do CGM monitoring. So these things are the ways you can help educate the patients who have diabetes to improve their overall outcome.
The revolution, some patients, especially recently diagnosed as diabetic patients, suffer from maybe psychosocial challenges. So, how do you address the psychosocial aspects for diabetic management in your practice?
When you ask me about this question, there is a particular case that comes to my mind. So there was this one time the patient had come to me complaining of weight loss, that she doesn't have even though she's eating too much, she doesn't have weight gain. She's continuously losing the weight. She was complaining of some numbness in the hands, not being able to focus on work, and all of these things. So when I ran some tests, she was just 21-year-old. So when I ran some tests, I saw fasting sugar was almost 300 plus. Now, just imagine that you're a 21-year-old who is looking, happily towards the outcome of life in the future. And now I have to convey to you that, okay, you have diabetes and you'll be on lifelong medication. So this was I still remember this moment. It was a very hard thing for me to do, and when I conveyed the message to the patient literally cried in front of me. And I was like, so first thing you have to be is you have to be empathetic, meaning that you have to try to understand what is the gravity of situation. For you, it might just be a diabetes diagnosis, but for a patient, it's something that changes their life completely. So having empathy and understanding is very important. So empathy and understanding, meaning like understanding in a sense that if the patient comes to you, you do not just tell you have diabetes, give the medication and send them home right away. Have some conversation, open their mind about living with diabetes, because since they have diabetes already, what can we do? We cannot do anything much besides medications, but you can open their mind, change their perspective. Another thing that you can do is involving the family, because if you are fighting a battle alone, it's going to be a long, hard road. But if you have supportive friends, families, or active groups that are of the similar age ranges who are suffering from the diabetes, where they can discuss personal issues, that is another thing. The third thing is, like we always say, patient education. So one of the things that I tell most of my patients is that diabetes is not the end of everything. Okay, this is a condition where it just means that your body is not functioning properly. So, for example, if you have a vitamin deficiency, what do? You take a vitamin tablet. So, you have to think it like your body is deficient in something because of which you are taking the tablet just to make sure that your body functions properly. And taking the medications will take you only 10 seconds per day, but it will help you improve your lifestyle. It will help you improve your life expectancy more than 10 years. 10 seconds or 10 years, you really have to be careful and choose which you would like. So these are the things, sometimes when you tell the patients, they tend to get a grasp of, okay, this is really happening. And of course, when the conditions become very serious, like, people also on the first diagnosis of diabetes, people tend to get depressed. Of course, like, you're looking, your life is like, still ahead of you, and you're diagnosed with this condition that you're supposed to live with forever. So of course, getting depressed or having anxieties or fears, these are common things. So if these are not like controlled just by some counseling, mental health support team can be included as well to help them understand, to let them accept what is really happening.
Great. And finally, Dr. Yushan, I want to ask about the advancement in diabetes management. Are you already excited about, and how this advancement may impact the patient outcome?
When we talk about the latest advancement, there are some certain things that has been going on. Like, there are gene therapies. Gene therapy is basically like, now you're trying to target those genes, those naughty little genes that causes the insulin problem. So now when you're replacing that dysfunctional gene with a proper gene that encodes for the insulin and everything, of course, you'll be trying to take away the type 1 diabetes at all. So there are like studies, there are gene therapies that are being studied. Another therapies are like immunotherapies, like some certain medications that can delay the onset of diabetes. So imagine like living with diabetes for 50 years or living with diabetes for 10 years. Of course you would choose 10 years. So there are medications that can usually like delay. There have been some approved medications, but there are still more studies ongoing to see like what medications can further delay the onset of diabetes in young people. Other things are like there are studies, stomach, not only stomach, the whole gastrointestinal system is very amazing. It's so amazing that everything that you put into your body has to go through it. And there are studies now that is showing that gut microbiomes also has a very significant effect on glucose metabolism, and so insulin sensitivity also. So there are studies trying to see that if we put some certain things in our stomach, like some certain probiotics or something like that, maybe it can increase the insulin sensitivity, or maybe we can trick bacteria into thinking this is that, and trick them into increasing the insulin sensitivity and like that. Other things are like that we are already using now, like wearable technologies. Maybe in future there will be watch where you can just wear a watch and you can see, okay, this is my sugar level now. Maybe these are like watches are there that will tell you, okay, your sugar is getting this much, please take your medication, this is your time. So of course, like these days, I think one of the most common medications, everybody is like wow with it, is like Monjaro or something like that. We call it GLP-1. So medication, these medications are also on the way that can really help. For now, people are having to take one tablet like twice a day, one tablet thrice a day, multiple tablets, multiple times a day. So maybe in future there will be a tablet that you can only take like once in a month, or maybe once in 6 months. So these are like very exciting new new advancements that are being studied. So hopefully, for everyone's sake, I hope somebody comes up with something that you only have to take once a year, and that's it. You don't have to worry diabetes at all.
And finally, I need to thank you so much, Dr. Yushan, for sharing your valuable insights on MedSynapse platform, and stay tuned for more episodes. Thank you, Dr. Yushan.
Thank you so much, Ayana, once again. And I hope everybody has taken something out of the session. And please do not forget to like and subscribe if you like the video.
Thank you so much, and waiting to see you again in different episodes.